Hey everyone, it's Loretta. I just wanted to go over the interpreting abbreviations assignment with the key, and everybody did really well on it. And they're just like one or two little things. The problem with abbreviations, and one of the reasons why we want to use as few of them as possible, is they can be ambiguous. So in one context, the same abbreviation might mean one thing. In another context, it might mean another. And I saw some examples of that in people's answers. So we'll just quickly go through each one and I'll tell you some of the things that I've seen. So the first one, manual muscle test, is 3 out of 5 for the right quadriceps. So really MMT was just the abbreviation. Everybody got that one. And 3/5 isn't really an abbreviation. That's just the way it's noted. The second one was very vague. So PT can stand capital A for 30 seconds, LOB. What the heck does that mean? That is very vague. Most people got patient can stand, and that A is not specific enough. That could mean with or without assistance. It's not telling us mod min or max assist. That's I would hate to see that in a chart because you don't know what the person means. For 30 seconds with or without loss of balance. It doesn't specify in there. So if you were going to abbreviate the heck out of this, you could say patient can stand. You can either do W/ or C with a line over it if you're writing it. Min, mod, or max assist. You have to say what kind of assist or contact guard or whatever it is for 30 seconds. And then you have to say with or without loss of balance. So that's a terrible sentence, and people did well figuring it out, but that's too abbreviated. Important information is left out. So that's one of the problems with abbreviation. Number 3, patient can transfer from bed to wheelchair, mod assist. That's how it should say. That's how it should say it, using SB. So what's an SB? It's a slide board or a sliding board. Some people had some other things that they thought of for SB, but slide board is what this is abbreviating. Okay, is SB really vague? Absolutely. So do we want to say slide board instead of SB? Absolutely. So you might be beginning to get the idea that I'm a little bit down on abbreviations at this point. And in the day now of electronic and dictated documentation, and people in everywhere, other healthcare practitioners and patients being able to read your note, be as clear as possible and only use abbreviations if they are 100% clear. Okay. Number 4, patient instruction performing right short arc quad for the SAQ, 3 sets times 10 reps. And, patient instruction performing right short arc quads, 3 sets of 10 repetitions. So that is pretty clear. SAQ might be something that isn't familiar to somebody in another setting outside of PT. In PT, SAQ, it's short arc quads. But we could probably come up with some other things. One time at the main campus of the hospital that my clinic is associated with, in the therapy department, they put up a board and they had everybody come up with things that SLR might mean. And you can come up with lots of crazy stuff. Usually we mean straight leg raise, but people said like slow lengthy recovery. You could come up with a million things. So the idea is let's be clear and not use so many abbreviations, specifically ones that are discipline specific, because other disciplines might not understand them. There's some things that are across the board, like WBAT, which comes up in number 6, weight bearing as tolerated. That is usually understood across disciplines, but some things are pretty therapy specific, and so we need to be clear on those. Number 5, the PROM, passive range of motion, for right ankle dorsiflexion is 5 degrees. Very clear. That's not too horribly abbreviated. Number 6, received RX from MD for WBAT on LLE. So an order or prescription is what RX stands for. Some people put therapy or treatment, and RX that's pretty much cross-disciplinary prescription. So when you see a pharmacist, it's RX. And RX means prescription, whether you're prescribing medications or prescribing therapy or anything like that. So it's a referral, an order, or a prescription from a physician, RX. From a medical doctor, MD, obviously, for weight bearing is tolerated on left lower extremity. So WBAT is one of those ones that's pretty cross-disciplinary. Most people in healthcare know what that means. Is the patient going to know what that means? Probably not. So weight bearing is tolerated, even though that's a pretty standard abbreviation, if your patient is reading the note, they might not know what you're talking about. So number 7, patient instructed to perform HEP BID, 10 reps of each X. So HEP, home exercise program, BID twice a day, QID is 4 times a day. So that's pretty standard medical terminology, but is the patient going to understand it? Probably not. 10 repetitions for each exercise. So think about who your audience is, and the other person in the audience, if you want to think of it this way, is the insurance adjuster who's deciding whether or not you get paid based on this note. And a lot of insurance adjusters, no insurance adjusters are medical people. They probably have some on-the-job training in medical terminology, but they do not know things like HEP might be an unknown term. And I've been in the hospital and written HEP and had nursing ask me, what is that? And well, we know it's the home exercise program. So that's kind of a therapy specific thing that other disciplines might not know. Okay, number 8, patient admitted to the ER 10, 12, 15 with GCS of 4. So most people got that that's the Glasgow Coma Scale, which is a way of telling people's level of consciousness. Admitted to the emergency room. I think ER is pretty well known, and most places say ED, emergency department. Most hospitals do. And 10, 12, 15, that's an acceptable abbreviation. You don't have to spell out October 12th, 1915. Oh no, wait, 2015. So it is useful to write out the whole year. Just so we know they weren't admitted in 1915. That'd be pretty unlikely to see on a chart, but it could be misconstrued. So number 9, medical DX of R hip fracture, ORIF. So DX is another one of those X terms. There's a lot of them: TX, RX, DX, SX, CX. So those can be sketchy because people can misconstrue them. Medical diagnosis, DX is pretty clear diagnosis. Right hip fracture with ORIF is a name of a surgery, open reduction internal fixation. It means they cut it open and they put screws in there. So ORIF is a pretty commonly seen one. The patient might not know what it is, but the doctor, the other medical professionals, the insurance adjuster, they're probably all going to know what that is. Because there is actually an ICD-10 code that is that. So that one's pretty clear. AROM, BLEs, WNL. Most people got that. Active range of motion in bilateral lower extremities is within normal limits. The other one you'll see is WFL, within functional limits. So within a therapy setting, AROM and PROM are commonly used. If you're dictating, though, it's a lot harder for the dictation software to understand what you're saying when you say AROM. If you say active range of motion, it'll get that and it won't mess it up. So something to think about. Usually the use of abbreviations is for handwritten notes because you're trying to compress the time. So with the advent of electronic medical records and dictated notes, you don't need to use abbreviations as much. So number 11, patient instructed in use of TENS unit on PRN basis. That's pretty clear. You don't have to write out transcutaneous electrical nerve stimulator, but you can. And on an as needed basis, PRN is as needed. Most people got that one. CPT times 20 minutes, P and V are LL. So most people got that CPT was chest physical therapy for 20 minutes. Percussion and vibration, that was that's a weird abbreviation. That's not really a standard one. And right lower lobe. So those percussion and vibration and right lower lobe are sort of specific to chest PT. So in context, it makes sense. However, you would probably want to write it out. That having been said, you'll find out in your special topics class next fall that you might be performing chest PT if you live in small town USA and there aren't a profusion of medical professionals, but these days, most of the time, chest PT is performed by respiratory therapists in a hospital setting, or somebody else in a skilled nursing facility setting. So we are not doing chest PT as much as in previous years. But if you work in small town USA, you might be writing this in your note or probably dictating it, I would guess. Number 13, patient was DC'd from NICU on 3/3/15. DC is discharged. NICU is the neonatal intensive care unit and the date that they were discharged. So I think most people got that really easily. PMH, IDDM times 5 years and HPP times 10 years. Probably every doctor and nurse and everybody out there is going to understand that. The patient's going to go, what? And probably most therapists are going to have to furrow their brow as they look at that. So past medical history, insulin dependent diabetes mellitus. A lot of times you'll see DM for diabetes mellitus, or more likely now these days you'll see type 2 diabetes or type 1 diabetes. So type 1 is insulin dependent diabetes, and we will see that in the endocrine chapter in PTA 274. High blood pressure, HBP, for 10 years. So pretty straightforward. Number 15, MRI. Everybody kind of knows what an MRI is these days, magnetic resonance imaging. A lot of people might know the abbreviation and not know the term, but we know it's imaging. It revealed MOD, which is moderate, left, MCA, CVA. So in the context of a cerebral vascular accident or a stroke, MCA means middle cerebral artery. Middle cerebral artery strokes are 60% of strokes are MCA strokes. So the things we think of as typical stroke symptoms are usually MCA stroke symptoms. Okay, some people put motorcycle accident but within another context, that is the same abbreviation. So context is important, clarity is important. If there was ever any question about it, I would write it out. So that's kind of our rule, is when in doubt, write it out. If it seems ambiguous, it probably is. So middle cerebral artery, CVA, and that's a context sensitive thing. Number 16, patient instructed to use MHP on CS, Q2 3 hours, PRN. Boy, we threw those all in there, right? So MHP is moist heat pack. And a lot of people put cesarean section for CS in a therapy setting. We don't do that. We don't usually treat that. Cervical spine is usually CS. But wouldn't it be more clear, even if you just wrote C-spine or just wrote out cervical spine, it would be a lot more clear. Q 2 to 3 hours, which is every 2 to 3 hours. PRN is as needed. So the idea of this exercise is really to see that it might seem utterly clear to you when you write all those abbreviations out, but it has to be utterly clear to the person that you're trying to communicate with. So not this week, but the following week, we're going to have the opposite, where we have a sentence all written out and you have to put it into clear abbreviations. So there are times when abbreviations are appropriate and useful, and there are times when they are confusing and unclear. Like number 2, that was way too abbreviated and it was confusing and unclear. So hopefully that makes sense to you, and we're going to just work on refining our use of language in our SOAP notes and making them utterly clear to everybody who has to read them.